The Ministry of International Relations and Cooperation is pleased to inform the Namibian public that the Namibian ambassador to France, Albertus, Aochamub, has recovered from COVID-19 and has been discharged from hospital in Paris. He has been reunited with his family. Now, as the coronavirus death toll rises, so is the number of recovery stories. And joining us via Skype is the Namibian ambassador to France to tell us his story. Very good evening to you, sir, and thank you so much for joining us.
Very good evening, and thanks for having me.
Firstly, let me congratulate you on a full recovery and a new lease on life. Tell us a bit about your journey with COVID-19. What does it feel like? What goes through your mind when you are in isolation?
There's a lot of things that happen. Firstly, I must say to you that this experience is one that you cannot equate to anything that I have experienced before. It is vicious. It is painful. It's an experience that I don't wish on anybody. If you don't have a very strong mind, you could easily give up on life, because when you are in pain, when you are by yourself, and the only thing you have is your mind to keep yourself, to remind yourself that you can't go now, not like this. If you don't have that kind of mind, it's very easy to succumb to the disease, because all the drugs, everything that they give you is experimental. There is nothing that's proven. There is nothing that is certain. And if your immune system is compromised, if you have pre-existing problems, those are all things that can compound the problem.
Mm-hmm. Now, France has the third highest number of deaths with over 3,500 fatalities. Having experienced their health system firsthand, do you think they can beat the odds stacked against them?
The French system is resilient, it's very well resourced. And if you can see, the president leads from the front. They have made additional resources available. In fact, the facility that I was being treated in is a public hospital funded through public resources. I had at my disposal every day of the week at least 3 medical practitioners that attended to me, gave me full debriefings on my situation as it evolved. Every 2 hours, you had people that would take your samples, blood pressure, heartbeat, all the essentials, and keep an eye on your essential organs from not collapsing. So I am fully convinced that the French are geared, they will prevail.
Mm-hmm. No one is to be blamed for getting COVID-19. I mean, from its rapid spread across the world, we have seen that COVID-19 does not respect borders. It does not care where you're from, how rich or poor you are, etc., etc. Has France created a supportive environment where COVID-19 and its impact can be discussed and addressed openly, respectively, honestly, and guided by science?
Absolutely. Nobody is going to know prophets to go and drink anointed water and all kinds of concoctions that I've heard about and I read now people are supposed to take. This process is very clearly explained to all of us that there are clearly stipulated medical processes. You will get your advice from medical practitioners that are trained and attentive. That's the only thing we follow. But what is also most important is, remember, this is a very established democracy, and matters like this are openly discussed, that nothing is sacrosanct. So I think they are prepared. At a much more personal level, every patient in the hospital, other than the fact that you have medical doctors and so forth, there is always a psychologist who stand by who every day will make their turns, check on your psychosocial welfare, just bounce off ideas, see how you're keeping. So there is complete care. The system is geared to look after its sick.
Lastly, Mr. Ambassador, words of encouragement to fellow Namibians who are watching this interview right now in light of the fact that Namibia is also battling the pandemic.
All I can say, quite frankly, is that this happens to anybody. It will happen it does not. A lot of people are asking, oh, so how did you catch this and all of that? What I know for certain is that if you don't practice the established social distancing, if you don't wash your hands with soap under running water, if you do not stay home, lock down, and avoid public places, you are bound to get it. So all I can say at this time is we are given the best advice there is to be given. I think all of us as citizens have an obligation to follow that advice to the letter, then we will be fine.
All right, Ambassador, thank you so much for your time and all the best. Thank you so much.
Thank you. Thanks for having me.
That was our ambassador to France, Albertus, Aochamub, sharing his story and his experience with having COVID-19 and time spent in isolation, and also giving a word of encouragement to Namibians.